Good afternoon, colleagues. Thank you very much for joining us today. I know it is extremely busy in all your schedules, and we'd like to get going so we can try and fit in this very long program in the time allotted to us. I want to welcome you to the 9th meeting of the Friends of the UN Task Force for the Prevention and Control of NCDs. This is a hybrid meeting, so we'll have a couple of people joining us online. It's hosted this year by the government of the Philippines, to which we are very, very grateful. The task force, of course, and WHO. And I'm very honored to be able to say that it will be co-convened by WHO, my colleague Jérôme Salomon, Assistant Director General, who will join us from Geneva virtually, Dr. Hanan Balki, who is the Regional Director for EMRO, which is, as you can understand, the Eastern Mediterranean region, the busiest region in the world for WHO's work. And also by Dr. Maria Rosario Singh Verguer, who is the Undersecretary of Health for the Philippines. May I ask first Dr. Svetlana Axelrod, who is responsible for the Task Force Secretariat and the Global NCD Program, its director, to make some opening remarks. Svetlana, nice to see you.
Nice to see you, Werner, and welcome greetings from Geneva. We are in a hybrid format. It's very nice that we have a lot of participants who are joining us today. And thank you very much for this kind introduction. I hope you can hear and see me. I can see myself on the screen.
You are loud and clear, and you look beautiful.
Thanks, Werner. Yeah, very kind, as always. So, dear Excellencies and the honorable ministers and distinguished guests and colleagues and friends, and it is a great pleasure and honor for me to start this meeting today. Good morning, good afternoon, good night to someone who is joining us virtually. And following the Werner's welcome, I am delighted to extend my warmest greetings on behalf of the Global NCD Platform Department that I am leading, and also on behalf of ADG Jérôme Salomon from the WHO from headquarters in Geneva. And first of all, I would like to thank the government of the Philippines for hosting this event. And your global and national leadership on the NCDs is so important. Let me significantly acknowledge your support, especially for the Health4Life Fund and your outstanding contribution to the recent International Dialogue on Sustainable Financing on NCDs and Mental Health that was held at the World Bank in June earlier this year. So, the Friends of the Task Force meeting are now a well-established event during the UN General Assembly, and they provide an opportunity to review the work that the UN Interagency Task Force and hear from our partners of all the achievements of our collaboration that we have under the task force. And as you remember, the task force is a secretariat which is placed in the department that I am leading, Global NCD Platform, in the division of the UHC, Universal Health Coverage, Communicable and Non-Communicable Diseases. And it consists of the more than 40 members that could provide even more effective support to the member states. And it is always a pleasure to celebrate the success being made by the governments and also non-state actors. And our annual award, as we call it, Task Force Award, do that and look forward to hearing the names of this year awards. As the previous years, we will be also hear from our team, from Alexei Kolyukov in the Task Force Secretariat, who will provide us with an overview of the work of the task force over the last years. And as usually, the work of the task force secretariat and its members are provided to ECASOC every year. Let me conclude by thanking the government of the Philippines and El Salvador for the co-facilitating this year's resolution on the work of the task force, and thank you to the large number of the member states that co-sponsored this resolution. The resolution provides a critical roadmap for the task force to ensure that it provides the necessary support that member states require ahead a next year high-level meeting on NCDs and between 2030. So let me stop here. Thank you once again, Werner. Over back to you, and please take over. Thank you very much, dear colleagues.
Thank you, Svetlana. As she has mentioned, we have a full program. We will have the task force award ceremony following shortly, panel discussion, and also a spotlight moment where we will focus on fiscal support for NCDs and also regulatory requirements. But first, I want to introduce the host country, the Philippines. Minister, please, if you would like to join us. Yes, please. And I will take the stairs now for the first of 10 times this afternoon.
Good afternoon to all of you. I am the Deputy Minister in the Ministry of Health in the Philippines. Honorable Chair, distinguished delegates, and esteemed colleagues, good afternoon to all of you. On behalf of our Philippine delegation, it is our greatest honor to be part of this third annual meeting for the Friends of the UN Interagency Task Force on the Prevention and Control of Non-Communicable Diseases and Mental Health. In the second International Dialogue on Sustainable Financing for Non-Communicable Disease and Mental Health in Washington, D.C. last June 2024, the Philippines expressed its intent to take on a bigger role in the global stage in addressing non-communicable diseases and mental health. NCDs account for over 2/3 or 68% of all deaths in our country, killing many Filipinos who are at their prime. On the other hand, anxiety and depressive disorders are the most common mental health conditions, causing health loss across all age groups and locations. It is with great pride that we highlight the Philippines' commitment to sustainable financing for these public health concerns. The Philippines is one of the few countries to have conducted both a national investment case for non-communicable diseases in 2019 and a national mental health investment case in 2021. In light of this, allow me to share some of our findings. The national investment case for non-communicable diseases conducted in 2019 showed that economic losses from NCDs, both direct and indirect, amounts to 756 billion pesos or $14.5 billion per year, and it is equivalent to 4.8% of our gross domestic product. Second, investments for selected best buy intervention packages such as tobacco control, alcohol control, salt reduction, and physical activity awareness were estimated to cost around 28.9 billion pesos or $555 million over 15 years, with a return on investment of 8.8 for tobacco control, 7 for alcohol control, 29.2 for salt reduction, and 12.7 for physical activity awareness. These initiatives, together with the implementation of the Universal Healthcare Law passed in 2019, have contributed to the development of the Philippine Plan of Action for Nutrition, Multisectoral Strategic Action Plan for NCD Prevention and Control, various tobacco control policies, tobacco and alcohol taxation, as well as guidelines for labeling prepackaged food with a shift of focus from treatment to primary care and health promotion program. This investment case also contributed to the development of the Health Promotion Framework Strategy for 2021 to 2030. I'd just like to make mention also that we have different legislations already being implemented in the country, such as the excise taxes on alcohol and tobacco, where we get funds for our implementation of the Universal Healthcare Law. And also we have the TRAIN law, which includes the law on sugar and sweetened beverages. We also have increased our budget tremendously for cancer and mental health, where it already has around 1.5 billion for mental health and almost more than 2 billion for cancer. Also, for our PhilHealth benefit packages, which is our social health insurance, we have already improved our benefit packages for both mental health, non-communicable diseases, including cancer. Based on our own actual experience on sin taxes, concrete policies on health financing can indeed facilitate transformative change in the healthcare system. The Philippine experience on health taxes was an arduous process and required a lot of political will and technical expertise. But in the long run, these policies facilitated the reduction in the prevalence of smoking, generated funds for the implementation of universal health care, and provided financial risk protection to millions of Filipinos, making health a tangible reality for every Filipino. For the Philippines, primary health care and health promotion are crucial in advancing non-communicable diseases and mental health reforms. We need to, first, put in place provider payment arrangements that will enable integrated primary care delivery services. Next, develop and implement fiscal instruments, whether through taxes and incentives that will address risk factors and the social determinants of health. Third, incorporate non-communicable diseases and mental health interventions in our benefit packages for our social health insurance, and to monitor our out-of-pocket expenses to ensure financial risk protection and avoid catastrophic spending caused by non-communicable diseases and their complications. To highlight our recent commitments, the Philippines is taking part in the UN Multi-Partner Trust Fund for member states catalyzing country action for non-communicable diseases and mental health, also known as the Health4Life Fund, seeking to catalyze action in low and middle income countries to strengthen their responses to non-communicable diseases and mental health and achieving SDG targets 3.4. As we all know, investments in NCD prevention and care are investments in the health systems of tomorrow. By engaging with the Health4Life Fund as a strategic partner, the Philippines will be in a better position to implement the strategies and programs necessary to achieve these goals. Targeted interventions can help reduce health disparities, ensure equitable access to healthcare services for all of our population. Lastly, the Philippines is very honored to invite all of you to the third International Dialogue on Sustainable Financing for Non-Communicable Diseases and Mental Health that we will be hosting in the year 2026. This was a commitment shared by our Secretary Ted Herbosa, during the closing of the second International Dialogue last June of this year in Washington, D.C. Through collaboration, shared knowledge, and sustained investment, we can transform NCD and mental health systems not only in the Philippines, but globally, ensuring that NCDs and mental health is a right, not a privilege for all. Thank you very much.
Thank you very much, Dr. Rosario. And also thank you to not only the government of the Philippines, but your permanent mission here in New York for all the support they have provided us in the work we do here on water sanitation and hygiene, on NCDs and several other topics. Really excellent leadership. Thank you. May I now turn to Jerome Salomon, who is the Assistant Director General for UHC and NCDs, who has sent a video message. He could not travel to New York, unfortunately. Joe?
Distinguished colleagues, friends of the United Nations Interagency Task Force. It's an honor to join you today as we reflect upon the critical work being done in the fight against non-communicable diseases and in support of mental health as we look ahead to the 2025 UN General Assembly high-level meeting. Over the years, the global NCD platform and the task force have not only championed multisectoral collaboration, but have also ensured that our work is rooted in country-level impact. It's a model of how the UN can and should work together, leveraging our collective strengths to deliver on global health commitments. I am particularly excited about the task force launch of the health tax tools, the global business case on digital health for NCDs, and work in supporting countries to scale up their digital health tools. The UN Health4Life Fund is also providing important leadership, with Rwanda and Zambia leading the charge in our first funding round. None of this would be possible without the unwavering support of our partners, including governments of Scotland and Mauritius, the Lilly Foundation, and the WHO Foundation. Together, we are shaping a healthier, more equitable future. Thank you.
Thank you. And now for the person you have all come to see this afternoon, Dr. Hanan Balki, who is the Regional Director for Eastern Mediterranean region. She will conduct the award ceremony. So all the photographers can start coming closer to see who are going to be receiving their awards. Hanan?
Thank you, Werner. That's very kind of you. It's a true pleasure, Your Excellencies, colleagues, ladies and gentlemen. Before we start, I'll give a brief comment. It's a true honor and pleasure to join you for this very important event. Let me start by, of course, thanking the Republic of the Philippines for organizing it, and of course, the task force for their continuous work to push forward action on NCD prevention and control. Unfortunately, that work remains badly needed. While NCDs cause 3/4 of all deaths worldwide, they receive only 1 to 2% of global financing investment for health. And while NCD mortality and morbidity could be greatly reduced through proven policy and legal and regulatory measures, it is still challenging to achieve the multisectoral coordination that is needed to implement such measures effectively. We are keenly aware of the need to scale up action on NCDs in the WHO Eastern Mediterranean region. NCDs are responsible for more than 2/3 of all deaths in the region, and more than half of those deaths occur prematurely, before the age of 70. The proportionate death due to NCD is worrying in all settings, including in our emergency countries, where lack of access to treatment and widening inequities is a fact. We have some of the highest rates of obesity and overweight in the world, particularly among the high and middle income countries of the region. Nearly 6 million children under five are overweight, and obesity now affects around 1/5 of the adult population. Tobacco use is still increasing in some countries of the region, and we also face other challenges with unhealthy lifestyles, air pollution, and threats to mental, physical health, and well-being. Countries have been working to address factors and promote healthy lifestyles, including robust legislative, fiscal, and regulatory actions. But in some places of our region, we actually need peace. While I was in Gaza, I saw devastated infrastructure that has been destroyed, running sewage and piling garbage. In Sudan, I saw access to clean water as a huge challenge. We are seeing changes in taxation to control the use of tobacco and sugar-sweetened beverages in the region, particularly in Gulf Council countries. More countries are introducing bans on advertising, promotion, and sponsorship of harmful products. And we are also working with countries to support the application of health warnings and food labeling. As you all know, introducing such measures often involves confronting powerful commercial interests. It therefore requires strong, high-level political commitment, and I would like to take this opportunity to thank all the leaders in the Eastern Mediterranean region and globally who are standing up for those interests and pushing hard to create a brighter, healthier, peaceful future for their people. We have a lot more to do. More challenges are arising all the time,
How should countries legislate to cover new nicotine and tobacco products? How can they prevent the promotion of unhealthy food through social media and other digital tools? And perhaps most critically, what more can we do to shield children from unhealthy marketing, messaging, and targeting? I'm looking forward to hearing your ideas in this very timely and necessary discussion and jointly implement the most effective solutions. Thank you for everything that you do. I will continue my next act. Okay. Again, thank you, Werner, so much. I've always been a competitive person and I love awards. I love cheering for people. Even if I'm not the winner, it's still a great moment to see people who have achieved something are being recognized and acknowledged. And that's why I think they chose me to give these awards. And I'm doing it really with a whole lot of passion, love, respect, and admiration for all the great work that you're doing. So, it is a great pleasure for me to formally present in the margins of the 79th session of the United Nations General Assembly 2024 Awards of the United Nations Interagency Task Force. The UN NCD Task Force Awards scheme recognizes outstanding achievements with a focus on multisectoral action for the prevention and control of NCDs, mental health conditions, and the broader health-related sustainable development goals. This year, Task Force Awards were arranged in partnership with WHO, Department of Health Products Policy and Standards, with the award schemes being expanded to recognize work in assistive technologies. Now let's move to announcing the awards. This year, we have 14 winners. Awards are being made in 3 categories. The first category is Ministries of Health and Government Health Agencies. The second category, Ministries and Government Agencies outside health. And the third category is non-governmental organizations, academia, and foundations. So are we ready? So everybody knows the protocol, how we're doing this. We have the awards, we're called the awardees. It is of great pleasure to announce the first winners in the category of Ministers of Health or government agencies under a Ministry of Health. We have 7 winners. It gives me great pleasure to announce the first winner, Ministry of Health of the Republic of Kyrgyz Republic. They're not finished? So they won't be, somebody will receive it on their behalf. For this award is given for their leadership, innovative approaches, and collaborative efforts in preventing and controlling non-communicable diseases and mental health conditions, with a particular focus on diabetes care, significantly contributing to achieving the SDGs. The second winner is the Ministry of Public Health and Social Assistance, Dominican Republic, for their innovative, comprehensive, and equitable approach to preventing and controlling NCDs, demonstrating exceptional commitment to health promotion and resource mobilization domestically and internationally. Congratulations.
Good afternoon to all, honorable chairs, excellencies, distinguished delegates, ladies and gentlemen, virtually and present here. It's really an honor to be standing here in behalf of my country and in behalf of my team in the Dominican Republic. From here, I send them a big hug because they are working a lot. As you know, non-communicable disease take a huge burden in health, socioeconomical issues, and in every aspect of life. And to achieve goals in this is really rewarding and it's really important for our countries. HEARTS, which is a strong strategy, has been proven around the world to help reduce the burden of these diseases to controlling 2 important diseases, diabetes and hypertension, that contribute the most to the propagation of
cardiovascular diseases around the world. We have established hearts in the Dominican Republic through a government leading program that has allocated total budget and distribution throughout the whole country to complete and free medication to all of the diabetic and hypertensive patients, also to protocolize care, standard care, and follow-up. It's extremely important to understand that one of the most important portions of care is nutrition. And we have developed, one of the reasons that we're here, we have developed a unique way of achieving nutrition in our country. We developed a program called SALSA, which means saludable y sabroso, which is healthy and delicious. It's not only salsa as a music, it's not only salsa as something you put on food, it's something that changes people and create education. We have understood that only through community and empowerment of community, we can achieve changes. Healthy and delicious stands out as a pioneering concept, introducing the glycemic index in the Dominican Republic as a tool that not only promotes healthy habits, but also honors and embraces our rich culinary traditions. Based on a local approach, we have utilized native products and adapted to our diets to current national nutritional needs in collaboration with societies, nutritionists, medical schools, and everyone there. And we have transformed the perception of health and raised awareness about nutrition, balancing flavor and health in a sustainable way. The only way that people will accept nutrition is you make it appealable to them. This award honors everyone that is part of this team. And I would like to say that it has changed dramatically our indicators in the Dominican Republic, and it's helped a lot in changing the way people see us as a ministry, see us, that is important. If they see you as a tool to help them, they will contribute to your effort. Thanks very much. Thank you very much.
You took my sheets. No problem. I usually can ad-lib, but this is tough. Thank you so much. Okay, it gives me great pleasure to announce the third winner, Ministry of Health of Ethiopia. For their increasing political commitment and adoption of a public health approach for the integrated decentralization of services to eliminate cervical cancer. Congratulations.
Thank you. Thank you very much, honorable ministers who are here and representatives, and also my dear colleagues, former colleagues from WHO. It's a real pleasure to stand here and receive this honorable gift presented to us. And I'm deeply honored to receive this award on behalf of the Ministry of Health and the people of Ethiopia and our government, who is committed in investing and working on non-communicable diseases. And Ethiopia has made, as we know, significant strides, especially over the past years, around non-communicable diseases. And the control and a comprehensive investment on non-communicable disease has been at the center of our policy. And we have set different policy strategies and a work that we do, an investment of at least the health workforce, which are at the center of our community. And the Ministry of Health has been pivotal in formulating different policies, implementing their policies, and transformation plans that we have for health sector transformation and investment plan. And this has been decentralized to the community at a primary healthcare level. And NCDs and mental health prevention has been part of the work we do in striding and using it for people-centered, multi-center approach that we do for our country. One of our notable success that was stated earlier is the work we do in cervical cancer prevention. Since our ministry and our country started to introduce HPV vaccine in 2018, recently we have 6.9 million women have already been, girls have already been vaccinated, which is very a proud moment for us. And our innovative approach, such as combating cervical cancer and different innovations, have significantly increased our screening and treatment service at a remote area. And over 1,500 health centers now and health facilities are already using HPV vaccinations at the center. We have also been scaling up people-centered chronic care and adopting WHO's tools, especially the Penhardt's protocol. And we have improved quality and accessibility of the care of hypertension, diabetes, and other chronic conditions. However, we still encounter some limits and resources, and especially when it comes to treating non-communicable diseases and NTDs, especially NTDs, where our progress needs to be seen a lot. Our progress wouldn't have been possible if our people were not cooperative, and our community is at the center of our policy and the political commitment we have. And in closing, I really extend our heartfelt gratitude, everyone in here who has contributed for the success of this, and our health extension workers who are at the forefront, and our students, our health workers at the remote areas who are still dedicated. And this award goes to our health workforce and our dedicated leadership who is steering at the front. But a motivation that continues. This award is not just for a recognition of our past achievement, but for the motivation that we continue for the journey to take forward for a healthier Ethiopia. And together we can achieve a goal of reducing premature mortality from non-communicable disease by 2030 with health for all and all for health. I thank you.
Thank you very much. Congratulations again. So it gives me great pleasure to announce the fourth winner, the Ministry of Health and Consumer Affairs of Andalusia, Spain, for leading a pioneering project across public healthcare centers in Andalusia to combat gender-based violence through a comprehensive accreditation system, training program, multisectoral collaboration, as well as significantly enhancing the support and care provided to individuals with NCDs and mental health conditions, and contributing to broader cultural and structural changes in the healthcare system. Congratulations. Our fourth awardee, the Ministry of Health and Population of Egypt, a dear colleague and friend. Congratulations. For the comprehensive public health approach of screening and treating NCDs in the primary healthcare level and through multisectoral collaboration. As a result, over 13 million citizens have been recently screened, with millions now being treated for one or more non-communicable disease. Congratulations. Our next awardee is the Indian Council for Medical Research. Okay. This award is for their work in disability rehabilitation and the use of assistive technology to improve policy, data, research, and leadership across the health sector. Congratulations. Our seventh awardee, Health and Family Welfare Department, Government of Tamil Nadu. Congratulations. For their program, Makalai Thedi Maruthavum, I think I pronounced it right, which delivers comprehensive home-based healthcare services, significantly improving access, treatment, and follow-up for vulnerable populations and strengthening the health system for NCDs across all levels. Congratulations once again. Now we move to the second category, which is the category of ministries and government agencies outside health and we have 3 winners. The first, Center for Development of Advanced Computing, Trivandrum, India. Congratulations. And they are connected with us online. I think they can see us.
Yeah, I'm connected. I think you can hear me.
Yes, we can hear
so
you.
The host
And
has to allow camera access.
What did he say?
They are unable to activate.
No camera access, unfortunately. And this award, this is a very all our interesting awards for their digitally connected tribal colonies project in Kerala that effectively integrates AI technology and indigenous medical devices to screen and prevent NCDs, including cervical and oral cancer and diabetic retinopathy among marginalized tribal communities using the local community to provide health education. Congratulations on this award.
Thank you. Thank you very much.
I don't see them.
May I say a few words?
Please.
Yeah, my name is Magesh, Director General of CDAC. First of all, good morning and good evening to all the UN members and the awardees who have won this prestigious award. We at Center for Development of Advanced Computing, CDAC, so we work on high performance computing, quantum computing, artificial intelligence, strategic electronics, software technology, cybersecurity, automotive, communication, health. Especially the award which is coming to us is based on the works we have done on the health vertical. So we come under the Ministry of Electronics and Information Technology, Government of India. And I thank the United Nations Interagency Task Force on the Prevention and Control of Non-Communicable Diseases for bestowing us with this prestigious international recognition. Cancer incidence in India is high and is projected to increase in the coming years. In Indian context, mass screening is the only way out for early detection and prevention. The major challenge here is mass screening is availability of resources like manpower and devices at affordable cost. CDAC is especially created to make this technology available to the masses at an affordable cost. So when we talk about all the technologies, our mission is to make that affordable to the masses. This indigenously developed assistive technology is the answer to this challenge. CDAC, in collaboration with the Regional Cancer Center, Trivandrum, has developed comprehensive systems for assistance in NCD screening using technologies like AI, robotics, and digital pathology. The mass screening program undertook by CDAC with fund support by the Ministry of Government of India and the Government of Kerala has successfully conducted door-to-door health awareness across 8,000 tribal families covering 33,000 family members in the district of Wayanad. The Wayanad is a hilly area, tribal, and most the infrastructure is very poor, and access to health care is very limited. So we have reached out to that isolated areas in that remote area of Kerala and Wayanad, and follow-up measures has been taken up for the precancerous lesions and connected cases. The program is a
Thank you so much, Your Excellency. We need to move on for the program. We are very keen to have your statement. We will post it online, as we will for any of the other awardees who have. Thank you so much, and congratulations one more time.
Thank you.
The next awardee is the National Institute of Physical Medicine and Rehabilitation in India. They are also connected with us online for their comprehensive provision of rehabilitation and assistive technology services with a multisectoral and transversal approach, including psychological and social work and community-based activities to improve health, including mental health conditions. Congratulations. Our third awardee in this category is the Tunisian National Television for their use of television to reach and sensitize the whole population on the importance and opportunities for preventing NCDs, especially around tobacco. Congratulations, Tunisia. Finally, in the category of non-governmental organizations, academia, and foundations, we have 4 winners. The first winner is Japan Heart Cambodia for their work in Cambodia on the treatment of childhood cancers and peer-to-peer exchange. Congratulations to Japan Heart Cambodia. Our second awardee in this category is Doctors with Africa, CUAMM, and NGO that works in sub-Saharan African countries for their work to improve health outcomes in rural Tanzania and their strong engagement with local and marginalized communities. Congratulations to Kwam. Our third in this category is Fiji Cancer Society, who are with us online, for being a vital force in Fiji's health sector, leading efforts in cancer awareness, advocacy, patient support, and palliative care, particularly for vulnerable and hard-to-reach communities, while fostering strong collaborations and regional partnerships to build a cancer-free Fiji. Congratulations, Fiji Cancer Society. The final, last but not least, the Center for Law and Policy Affairs, Bangladesh, for being a leading think tank advancing public health and environmental protection through evidence-based interventions, sustained legal advocacy, and strategic partnership that have driven impactful changes to tackle social determinants of health with a particular focus on NCD prevention. Thank you very much and congratulations.
Thank you, everyone. I'm honored to speak the important work of the Center for Law and Policy Affairs for CLPA, a national think tank focused on ensuring that everyone has access to quality healthcare and healthy life. Actually, I have a lot of things written here. I'm skipping all the things because time is short. So I'm grateful. I'm honored to have receive this award from the UN Interagency Task Force. And thank you all, everybody.
And thank you all. Thank you all. I'm getting really good ideas that we will work in our EMRO region specifically. But it was a true honor to see all this major work happening in different parts of the world. So congratulations to all those awarded today. We look forward to hearing progress on your work in the months ahead, and that these awards encourage even greater actions both by those awarded and others in responding to the challenges related to assistive technology and more broadly in all of the health sectors. And I have personally been honored to be presenting these awards to all of you. So thank you very much, and I hope you enjoy the rest of the session. Thank you.
Thank you very much, Dr. Balki, for making time in your busy day to present the awards and off to the next event. May I also just personally thank the ministers from the Dominican Republic and Ethiopia for coming here today personally to accept the awards and to spend time with us. But this enigmatic task force that everybody is talking about may be unfamiliar to many of you. So I'm going to ask my colleague, Alexei Kulikov, to say a few words briefly about what the task force done and what it has achieved. Dr. Kulikov, over to you. It's your turn or you will miss the turn. Alexei, It's now or never. If you don't speak, we move on to the panel. Going. Going.
Yeah, I think we had a
Sorry,
technical
speaking.
problem.
We hear you.
Yes, apologies when we had a technical problem. Mic switched off right before you gave me the floor. So apologies for that. And I know that we are very tight on time. I'll try to do it as fast as possible. Colleagues and honorable ministers and distinguished friends, good morning, good afternoon, and good evening to you. It's a real pleasure to update you on the task force's work to support member states achieve NCD, mental health, and broader health-related sustainable development goals. This year, we welcomed UN Road Safety Fund to the task force, taking the number of members to 46. Members continue to advance the 4 strategic priorities of the 2022-2025 strategy. The task force is currently undergoing a joint independent evaluation with 3 main objectives. First, to assess the task force towards the achievement of its purpose and strategic priorities. Second, to document the factors and challenges that have enabled and hindered progress. And third, to provide lessons and make recommendations for future use of the task force and its members. The task force's work over the last year is described in its annual report to ECOSOC. An action-oriented resolution co-facilitated by governments of Philippines and El Salvador was approved by the Council in July. And the resolution further broadens the scope of work of the task force in its support to member states. For example, by promoting access to safe, effective, quality, and affordable NCD medicines, scaling up digital health initiatives for NCDs and mental health, enhancing collaboration to promote better nutrition, healthy diets and lifestyles, and fostering partnerships to tackle NCDs and mental health conditions. The task force continues to provide tailor-made country support to enhance whole of government and whole of society support to address NCDs, mental health conditions, and drive forward actions on assistive technologies, digital health, and healthy diets, and road safety. This week, for example, we received a request from Cabo Verde for a joint programming mission to support the government implement actions set out in the 2023 Bridgetown Declaration. We are also being asked to relate the impact of multisectoral action plans. Again, by way of example, an evaluation of the Algeria multisectoral action plan has recently been completed. Countries continue to request support for NCDs, mental health, and other investment cases. Already last year, the task force has provided support to Bangladesh, Bosnia and Herzegovina, Ethiopia, GCC countries, Georgia, Kyrgyzstan, Jordan, Malaysia, Nepal, Tajikistan, the Gambia, and Uzbekistan. The summary of this work was presented in June at the World Bank WHO International Dialogue on Sustainable Financing for NCDs and Mental Health, along with a set of criteria to help guide when to undertake and to make best use of investment cases. We urge countries to review this when requesting an investment case. We continue to witness the impact of investment cases with documented improvements across governance, policy, and strategy, as well as strengthening fiscal, regulatory, and legislative measures. A recent study on the reported impact of investment cases was published this year in BMJ Global Health. We have recently published the outcome of the task force's flagship WHO-UNDP joint program for activities in 7 countries across Africa, the Caribbean, and the Pacific between 2021 and 2023, which aimed to catalyze multisectoral action on NCDs and mental health. Specific results of each country are included in the report. Key takeaways across all countries include that change requires engagement from parliamentarians, ministries across government, and non-state actors. Modest technical and financial support can catalyze sustainable action on NCDs and mental health. And cross-UN action advances integrated health and development solutions. I highlighted the importance of parliamentarians in the previous slide. To drive forward our work with parliamentarians, a new collaboration was announced in June at the start of the 2024 H20 meeting in Geneva between G20 and G7 Health and Development Partnership, the Task Force, and the Health4Life Fund. In first instance, the collaboration will develop an initiative to encourage legislators to raise awareness, be involved in and actively promote action to tackle NCDs and improve mental health. The UN Multi-Partner Trust Fund to catalyze country action on NCDs and mental health, the Health4Life Fund, established by WHO, UNICEF, and UNDP, will be disbursing funds to its first set of countries this year, with plans for a second round later this year. In addition to Kenya and Uruguay, the steering committee recently welcomed Mauritius, Philippines, Scotland as partners. NCD Alliance and United for Global Mental Health continue to represent civil society on the steering committee. In Rwanda, funds will be used to develop integrated models for delivering mental health and NCD services in schools and workplaces. The expected outcome is an evidence-based model for integrated care that can be scaled nationwide. In Zambia, a youth center program will support tobacco and alcohol control alongside improving mental health. Further to the call from the ECOSOC to the task force to support member states in scaling up digital health solutions, a global digital health business case for NCDs and mental health has been developed by the task force secretariat, WHO, and ITU, and was launched here at the General Assembly earlier this week. The report emphasizes that digital tools are a highly cost-effective way for countries to prevent and control NCDs. The task force has already started working with Brunei, Kyrgyzstan, and the Gambia to implement the report's recommendations. Today, the task force is launching an Action for Health Taxes brief alongside specific toolkits for tobacco, alcohol, and sugary sweetened beverages taxes. These tools, developed by the Task Force Secretariat, WHO, and UNDP, in collaboration with United Health Futures and Alma Economics, provide a framework to develop, strengthen, and implement health taxes with practical case studies and examples. We hope these tools will be useful for policymakers across government, civil society organizations, and other stakeholders, in particular in low and middle income countries. Here are the alcohol tax, tobacco tax, and sugary sweetened beverage tax papers. Those all are available on the task force's website.
We need to start wrapping up, Alexei, please.
Yeah, I wrap up in a minute, Werner, thanks. So the task force continues to track how NCDs and mental health are included in the UN Sustainable Development Cooperation frameworks, the key instrument for planning the UN development activities at country level to support implementation of the 2030 agenda. In our most recent analysis, again launched today, we see that 77% of countries include NCDs and 86% include mental health. We need to get those figures higher. But there are some big gaps. For example, alcohol. Alcohol is included in less than 10% of cooperation frameworks, and we are committed to addressing that gap. Well, in this short time available, I can only describe a small number of our activities. As always, Task Force's annual report to ECOSOC describes our work in detail, and it is available on our website. And of course, we will make this presentation also available on our website. Thank you for your attention, and back to you, Werner.
Thank you very much, Alexei. And now we transition to the panel, which I know all of you have been waiting for. While the seats are being arranged, I will call the panelists to please come up the stairs. The first is a familiar face, the Minister of Health of the Gambia, Minister Amadou Samate. Thank you for coming back. Last time I saw you was just Monday evening. And the minister is certainly worth listening to. So thank you very much for everyone staying here. May I ask Jose Castro, the WHO Special Envoy for Chronic Respiratory Diseases, also to join. Helga Fogstad, my friend from UNICEF, Director of Health. Natalia Lino, Deputy Director of UNDP, also an old acquaintance, and Mike Dunber, who is with Movendi. I'm sure he's going to tell us all to limit our alcohol intake to 1 glass a day, if that.
If at all.
If at all. Right. I want to turn first to Minister Samate to speak to us a little bit about the fiscal and regulatory issues around NCDs and how you deal with these challenges in the Gambia. Minister?
Thank you very much, and good morning to you all. Good morning to colleagues and everyone here present. Of course, this week has been very eventful with regards to the discussions on NCD, and we are very optimistic that it is bringing the issue to light. But back in our country, certainly, the policies are important. Various countries have developed various policy initiatives, various strategies. In many of our countries, the health policy has certainly a control element for NCDs. And with very good policies and strategies, if we do not have the legislative framework, unfortunately, we will not be able to achieve much. Whatever we want to do, could be contested, and we are not empowered. We are not authorized. With this recognition in the Gambia, the Tobacco Control Act was enacted in 2017. This was a milestone because this guided the Gambia as to what to do with regards to the control of tobacco. Now, with the Act, we went ahead to develop the tobacco control regulations. Now, the regulation, the minister is the custodian of the regulation. The regulations, bylaws, they expand, they expatiate on the Act because the Act cannot give all the details. Now, those powers within the regulation, fortunately, the minister has that authority to put forth the regulation with the approval of the cabinet. Now, that gives the fine details. We did our tobacco control regulation in 2019. Now, one important, very important aspect of that regulation is that it has made it possible for us to decide on, for example, the graphic health warnings on packages of tobacco. And as I said earlier, the high-level commitment, high-level participation is very important in this. When I became minister, the graphic health warning we have on packets of tobacco was actually a neonate who was fitted with resuscitative equipment or apparatus. Now, with an NG tube, with oxygen being given to the neonate, just to show how serious the use of tobacco could be for children, as early as at that age. That went on for a couple of years. But myself, I looked at it and I say, yes, this is good, but most of the smokers will not relate to this. Most of the smokers are not pregnant women. Some of them smoke too. And most of the smokers are actually young men who really, when they see pictures like that, they will start saying, well, it is saying that it affects children. It doesn't affect us. So we started to have a rethink, and we devised, and I sat down with the team and I said, probably it's better to have that graphic warning of the WHO's illustration of the smoker's body. I'm sure we are all very familiar with that. And really, that is making sense. So that's what you have on the packets of cigarettes in the Gambia now. So why I'm saying this is that high-level involvement, that initiative came from ourselves. That means we are very particular about what happens to the minutest details, which also helps our teams. We shouldn't leave everything with the technical people alone. We should also participate. Mr. Chair, the regulative aspects have been very good because with regards to now the tobacco tax. Now, this came into effect, the increment. The tobacco tax existed well before, but it was increased. Now, in 2019, with the recommendation from the WHO, we had a drastic increment up to 70%. Now, that meant a whole lot. And further down in 2022, we also had a 50% increment. Now, these both increments had direct impacts on the reduction of smoking, by 7%. Now, of course, they become less affordable to the majority of people, to the young people. Now, that impact is still ongoing because it is becoming more and more less affordable to the potential smokers, to the new recruits, and even to the older smokers. But the other side of it is, it provided a lot of funds for us to be able to use in providing services for the smokers themselves and other people. So it helped us get more resources for the health system strengthening. And I think that is a very, very, it's a win-win situation. It's a very important step. We tax cigarettes higher. Now, less people smoke, but we get income to deal with the problems cigarette is causing for those who smoke and, even deal with other aspects. The Gambia has also introduced the tax for the sweetened beverages, and that's also helping people because the prices of those have gone up, and that is making them less and less attractive for the people. People are tending to go towards natural juices now. They become popular. And then the advocacy aspect is also important from the government level. We all advocating, and interestingly or coincidentally, the Tobacco Control Unit is under the Directorate of Health Promotion and Education. So the same people who control tobacco and then other issues actually are our health promoters. So they are very well equipped with the promotion of healthy lifestyles and so on and so forth. I'll take a break for now, if you don't mind, but I could continue on and on and on to allow others to also participate. Thank you.
Thank you, Minister. That's really excellent. And may I commend you and especially President Adama Barrow also for personal leadership in preventing and controlling NCDs. We know that secondhand smoke affects millions of people in the world, also with respiratory illness. Jose, please, would you enlighten us from your side?
Yes, thank you very much for inviting me. Today actually is World Lung Day. We are celebrating or observing that on the fringes of the UN General Assembly. And I want to echo what the Honorable Minister said, the importance of the political leadership to drive the implementation of tobacco control policies, and especially taxation to which has two important effects. One, in the reduction of the consumption of tobacco, but also in bringing revenue to the government to address the issues of the illness that tobacco causes. Chronic respiratory diseases affect 500 million people in the world, and many of them develop this. The majority of them develop this disease after smoking. And the cost to the country, the cost to the families, to society is exorbitant. So the importance of implementing the Article 6 the Article 6 of the Framework Convention for Tobacco Control is an urgent priority for countries, and we've seen in countries where the taxes have been raised on tobacco, the consumption has reduced effectively. But I think, and I like to, commend the minister what he said about the political commitment is so important, because there are interests that will push and try to weaken these legislations, and without that political commitment to safeguard those policies, then they don't achieve the purpose. So I follow with interest the reports that were produced by the UN Interagency Task Force, and commend the work of the team in highlighting this work, and looking forward to continue discussion with you and member states on this important work. Thank you.
Thank you, Jose. WHO's work and the task force also is never done in isolation. We do many of the policy briefs with the UNICEF and with the UNDP, and all our investment case studies that we issued on behalf of the task force have been done with the three organizations. So great pleasure to ask Helga from the UNICEF side to speak to us on these topics.
Yeah, thank you so much. And first of all, I'd like to thank the Republic of Philippines and also WHO and the Task Force Secretariat for convening us. It is important to take stock of such declarations and to see and really follow them up. And also congratulations to the awardees. You're an inspiration to us. And also transferability across the world. And we then take lessons then with us to heart. I think what is important from the side of UNICEF is that it's important to see that the taxation for alcohol and tobacco and also sugar sweet products is a very cost-effective measure, and especially for young people, because rising the prices of these products are very effective towards young people because they're price sensitive. And so this is very important. One thing that is important for me to mention is that for countries considering such taxes, the protection of child rights is a powerful narrative that can help galvanize support. And framing the issue in terms of child rights presents compelling case for interventions. Every child has the right to grow up in an environment that enables them to thrive, free from the preventable harms caused by such products. I would also like to, at the end, as a co-chair of the Health4Life Fund, allow me to thank Lilly Foundation for their support to fund made through UNICEF USA. Thank you for such kind of support.
Thank you very much, Helga, and for the strong support of UNICEF. We really have many ongoing collaborations with UNICEF, investing in children's health, and NCDs affect children as they do adults. May I ask Natalia from the UNDP's side? Those of you that know the UN system know that there is always the two elephants in the room, three elephants. It's UNICEF, UNDP, and WHO, and we all count how many country offices we have to see who comes out first. But there are no awards for it, right?
Well, thank you so much for having UNDP, and thank you to the Philippines and to the task force and to all of you. A warm congratulations to the awardees, and thank you for all the work you do on the ground. So UNDP frames this work within the SDGs agenda because we know that of all the targets, we are only on track about 17% of the ones that we have data. And in fact, our Human Development Index shows that in the last 4 years, inequalities have simply grown. 3.3 billion people live in countries where the country spends more on servicing debt than on health and education. So financing and health have to go hand in hand. And health taxes, as we have heard, are really an important tool, an underutilized tool. They are a win-win, and thank you to the minister for sort of sharing that. They're a win because they bring new revenue. They're a win because they reduce healthcare spending. They're a win because they improve the lives of people, and especially the young people, where there's this elasticity. Yesterday, the Task Force on Fiscal Policy for Health launched their report, and they shared some really sobering data. If we are able to raise excise taxes on tobacco, alcohol, and on sugar-sweetened beverages by 50%, or to a point where the increase of the price of the products would be an increase of 50%, it could raise $3.7 trillion over the next 5 years. That is a huge amount, and in the process, save millions of lives. So clearly, this is important work that we are so proud to do in partnership. UNDP, as you mentioned, has been partnering with UNICEF, with the task force, to do these investment cases. And thank you to the Philippines for sharing some of those results. We see that these investment cases show us what it takes and that it can be possible. So we have been working in over 60 countries to ensure that, tax reform efforts are supported. And they're supported in many ways, but the investment cases are one way that we have been leveraging results to see action coming to the ground. And there's examples that my team put together from back in 2015, which was the first national NCD investment case in Barbados, and it helped increase taxes there. We have seen results in Ethiopia, the Philippines, and in fact, leveraging UNDP's SDG initiative, UNDP's tax for SDG initiative, we have seen Armenia, Ghana, Uzbekistan, and Zimbabwe be in the process of increasing taxes on sugar and sugar-sweetened beverages. But we also know that this is political and political leadership, and that it is difficult. Health taxes are sometimes seen as politically challenging, that industry will interfere, will try to undermine, will come up with narratives of smuggling or things like that. It is learning from each other, highlighting the good examples that are critically important, and then working together across ministries of finance, ministries of health, bringing in civil society and advocates to do this work. And I would be remiss if I didn't mention, because I do a lot of work on climate and health, that there should be an inclusion of sort of the carbon tax and the green taxes into this conversation, because we know that the climate crisis is really going to have an impact on NCDs in the world. So collectively, we can build new coalitions, and please count on UNDP to be a partner in this. Thank you again to the Lilly Foundation and to support to the UNICEF Foundation and to the new, to the work. And I really look forward to more support to the Health4Life Fund. Thank you so much.
Thank you, Natalia. It requires a truly brave politician to raise taxes. But politicians can be prompted by civil society. And the next speaker is Mike Dunbeer, who is from Muvendi International, a very large group of organizations that work on alcohol control. And I want to especially commend you. We have been talking for some days now about more comfortable shoes to get to all the events, but you have integrated your fashion sense also into your shirt and tie. So I think this is really the solution for all of us.
Fantastic. Thank you very much. Thank you for the invitation. It's a great privilege, big honor to contribute to the conversation. As I listen to everyone, speakers before, speakers here on the panel, my notes get longer from things that I take with me and the things that I would like to comment on. I will be disciplined though. I think it's really important to say that in Muvendi International, we deeply appreciate the work of the Interagency Task Force, helping launch the SAFER initiative that provides an alcohol policy blueprint for countries around the world, helping bringing in other UN programs and UN agencies into the conversation about the benefits that come from alcohol policy across the SDGs. And Werner, in Muvendi International, we are in the business of bringing the benefits of alcohol policy to the people, to our communities. And I think that's what we all have in common. We want our people, our loved ones to live long, healthy lives. And if there is a need that healthcare services are available, alcohol policy does that, helps contribute to this. And I think the briefs that Alexei briefly showed, they show this, they provide the evidence. And like we could hear from the Philippines, there are really good examples from countries that do this, that achieve success with this. And then in Muvendi International, we also, unfortunately, see countries where the alcohol industry is interfering, where we see barriers to bringing the benefits of alcohol policy to the people. I had a meeting with the Ministry of Latvia yesterday. They want to raise alcohol taxes and the alcohol industry is interfering. In Uganda, they want to raise alcohol taxes to bring healthcare, like in the Philippines, to the people, and the alcohol industry managed, unfortunately, to destroy, to derail that process. And one more country, in Canada, the alcohol industry managed to derail a beer tax increase. So that's around the world that these things are happening. And I think these realities are a good case for why the Interagency Task Force is needed. We need to bring countries together, we need peer learning, and we need to bring UN agencies together. I think it's fantastic that we have UNDP, UNICEF, together with WHO, making these cases. I think more UN programs, UN agencies can do that work. And in Muvendi International, we want to be part of that kind of solution, the way forward, because alcohol policy can really help us achieve and make progress towards at least 14 of the 17 SDGs. So that's I think, what we think we can do here together. Thank you.
Thank you very much, Mike. I want to ask Minister Samate for a final word because he has been listening very carefully to all the other panelists, and when he goes back, he needs to implement many of the things you were saying, those that he hasn't yet done. Minister?
Thank you very much. I think it's very exciting listening to all of you. Certainly the partnerships are very, very important with the UN partners and with local partners, local NGOs. And the Gambia Civil Society Organization has been very instrumental in making this possible. But I think what the ministry succeeded in doing is to get all those people together. But the head of the Gambia Revenue Authority, they are responsible for the taxation. They were made to understand that really this is important, and because they are the ones collecting the tax. But for them to have a buy-in, and of course the Ministry of Finance, because and the parliamentarians. So when government believes in something, of course the political will is there, but of course we also have to get the political structures. So we go all the way to explain to the parliamentarians why this. So we have task force and we have parliamentary caucuses that we also contact and to make them have a buy-in. That's very important. The interference or the potential for interference is everywhere, and then certainly attempts are made to justify. The Gambia is a very good tourist destination. I'm sure you all know. We call it the smiling coast of Africa. So when we want to talk about certain things, even some colleagues will come and say, but this will affect the tourist industry. Tourism is responsible for A, B, and C, this number of jobs. So you see how it could come. Sometimes it's not from outside, but our own colleagues who are also thinking of their own areas. We are thinking of protecting the health of the people, but they, for example, want the tourist industry to flourish. And of course, tourism tends to go with alcohol and tobacco, isn't it? So that becomes difficult implementation-wise. But I think the understanding is there. So they bring the hoteliers on board as well. They are part of the process. Of course, with all these laws and regulations, the enforcement is very critical. So enforcement too, the tobacco control unit of the ministry does it with other stakeholders, with civil society organization, with the youth groups, with the police, and so on and so forth, because the laws have to be enforced. So before I wrap up, of course, the legislative frameworks are very important for NCD control, but also typical NCD areas, but of course, mental health. We cannot go without saying something about mental health, which is critical. In many of our countries, the regulatory frameworks are still rudimentary or they're archaic. Gambia is one of those as well. So we are reviewing our Mental Health Act. We have a draft bill as we speak, but which needs to be modified. So we also will be able to do that before the end of the year. That's our target. But we encourage all countries to follow suit to ensure that we have vibrant mental health bills so that the mental health patients can also get the care that they deserve. We thank you very much, and we thank all the organizers, the partnerships here, the government of Philippines, the UN agencies who are all here for giving us this opportunity, to interact. I think this is very important. We cannot do it alone. We can only do it together. Thank you very much. Thank you.
Thank you, Minister. And a big round again for all the panelists. Thank you very much. As we transition to the almost final act, I want to thank them for joining us today. When we talk about regulation and fiscal measures, we obviously also need to talk about where the money comes from. And so the next three participants will talk to us a little bit about that. The Health4Life Fund, you have noticed already on the screen, is something that was newly established, multi-partner trust fund. May I ask Cynthia Cardono, President of the Lilly Foundation, to join us on the stage, please? Emmanuel Copabianco of the WHO Foundation, Chief of Strategy, and also Sophie Olsen, Director of Global Health Equity at Novo Nordisk. 3 seats remain here, please, for them. 2. Sophie is not here. Online. Right. I'm conscious that some of you may be hungry, and so am I. So I'm not going to stand between you and the food, although I've been standing almost the whole afternoon. The food will not be removed, and we will have at least 10-15 minutes to eat patiently before we have to run to the next meeting. So please don't be concerned. And thank you to all the ministers who have stayed with us, also up to now. May I ask you, Cynthia, to please tell us a little bit about what Lilly Foundation is doing to support NCD prevention and control, and how, well, I won't ask you how much money you're spending. How much money do you intend spending?
Thank you. Thank you very much. And just as luck would have it, my notes just went away. Just one second. Thank you. Esteemed attendees, thank you very much for the opportunity to be here today. My name is Cynthia Cardona. I am Vice President of Lilly Social Impact Team and separately serve also as the President of the Eli Lilly and Company Foundation. And as Eli Lilly and Company is an innovative medicine company, we feel and believe strongly that we have an important role to play in collective multisectoral action. We encourage stakeholders around the world to pursue action with the goal of access to care for everyone who needs it. And to drive progress, we established Lilly's 30 by 30 goal, which aims to improve access to quality healthcare for 30 million people living in resource-limited settings every year by the year 2030. Our efforts include a focus on non-communicable diseases and people living in resource-limited settings in LMICs. We work with global health organizations to address complex health challenges around the world. And we feel that these organizations have the knowledge and capabilities to enhance the education, diagnosis, treatment, and care of people living with NCDs. Our focus lies in championing innovative, sustainable, and scalable solutions to help address pressing global health concerns. We seek to facilitate cross-industry action to develop and test models of care to reach as many people as possible. And we celebrate best practices and models of care of enhancing capabilities of the healthcare workforce and systems, improving service delivery mechanisms, digital information systems, and so many other efforts. On that related note, I want to congratulate as well all of the awardees for today. Separately, in my role as president of the Eli Lilly and Company Foundation, commonly known as the Lilly Foundation, we understand that the promise of making life better for people around the world can't be achieved without helping communities thrive. The Lilly Foundation is a separate tax-exempt private foundation established in 1968 and supported by donations of Eli Lilly and Company, which support philanthropic programs across health, equity, and education, and they extend Lilly's reach and impact in a charitable manner. And as an example, and to your question, the Lilly Foundation is proud to announce that we have committed $4 million to the US Fund for UNICEF through UNICEF USA efforts related to supporting the Health4Life effort. This grant builds on the foundation's support of charitable organizations that address inequities and social determinants of health. And because multisectoral actions allow stakeholders around the world to contribute to improving access to care for everyone who needs it, we are very proud to support the US Fund for UNICEF in this innovative initiative, tackling non-communicable diseases in resource-limited communities in low and middle-income countries. So thank you very much.
Thank you, Cynthia. Emmanuel is Chief of Strategy at the WHO Foundation. As I mentioned, the foundation was established as almost a go-between between WHO and private sector who may wish to contribute to promoting health. But the WHO conflict of interest regulations sometimes prevent direct contact with such donors. So Emmanuel has a very important role. He has to make sure the money is clean and it's well spent. Please.
Thank you. Thank you very much. And first, allow me to thank the government of the Philippines and your Vice Minister for this event today, and also to thank you. You are running a marathon at an incredible pace today and very efficiently, Werner. WHO Foundation, as mentioned, has been created 4 years ago to mobilize partners, private sector, to provide financial support to the WHO, to support the work that is done by Svetlana and Jerome in headquarters, to support the political work that is being done by Werner, but more importantly, to support the work that is done at the regional level, at the country level, the technical support to countries in the development of the cases and the implementation of those cases. Private sector is a large beast with many different heads. What we try to do at the WHO Foundation is really to mobilize those elements of the private sector that are keen to provide financial support, that are keen to support the causes of NCDs. And I am very pleased. I'm a medical professional. I've been in this space for a number of years. I'm very pleased to see the different type of private sector that are emerging and have an interest in NCDs. We have built successful relationship with cosmetics companies involved in mental health. We're having very important discussions with pharmaceutical companies. We are having discussion with fitness companies that are very keen on promoting health and well-being for NCDs. There are other digital companies and media companies that are getting engaged. The medtech companies were just today with some of the members that were here having a very interesting discussion about the role of technologies in saving lives when stroke hits, and knowing this being the second cause of deaths around the world. So what we are trying to do is really to mobilize those resources, to channel them where they can make a difference, and in this true spirit of partnership, which is at the basis of the work of the task force. So if you are a company here, if you know companies that will be interested in investing in these areas, please do send this to us. We'll be happy to support the collaboration. Thank you.
Thank you, Emmanuel. I want to turn to Sophie now from Novo Nordisk. WHO has a long collaboration with Novo Nordisk on diabetes, among other things. So, Sophie, please, you have the floor.
Thank you very much. I hope you can all hear me.
We do, and we see you as well.
Good, fantastic. Well, good evening, everyone. Esteemed ministers and colleagues and chair. Really fantastic to be here, everyone. And I can only echo the words of the Minister of the Gambia saying, well, it's really about bringing everyone together. So I do also want to say, I think from our perspective in Novo Nordisk, I sit in our global health equity division, and I think it's really about partnership. We acknowledge a lot of that fantastic work that's being put in by the different ministries of health and all the awardees today that really are explaining how the NCD policies are not only policies, but also regulations and financing and so forth is moving along. We also do understand a lot remains to be done. Thank you to the government of the Philippines. Philippines is one of the new countries that we are also supporting as part of our sort of type 1 diabetes support. Type 1 diabetes is still something that we are strongly committed to supporting across the world. One of the NCDs that get a little less attention sometimes and very underdiagnosed and misdiagnosed. So we're also very committed to still bringing that to not only the different patients, but across better policymaking and so forth. I think in that context, we really want to recognize the importance and the leadership and sort of the bringing together by the WHO Foundation and how really private sector can contribute to the different mandates of not only the global different UN agencies, but really at the country level. That being said, I also think that we are seeing a lot of progress and positive action being taken in different countries. It was mentioned before by Alexi that if you look at the investment cases in a country like Bangladesh, we had a very positive change, on a policy change of reimbursement and basically provision for all vulnerable populations across Bangladesh of insulin for type 1 diabetics last year. So some of these NCD progress that we're really happy towards. So we are really, I think, committed to continuously supporting both at the global level, but also at the country level, better policies, accelerating NCD change, and we remain really committed to the WHO mandate of supporting vulnerable populations across the world. Thank you.
Thank you very much, Sophie. That concludes the money part, but there is one more prize to be awarded, and that is to the Ministry of Health of the Kyrgyz Republic, who could not be here earlier, and it's to be received by Dr. Mavlanbe Olurenat for their leadership, innovative approaches in preventing and controlling NCDs. Please. You mentioned, Emmanuel, that it's a marathon, and for two reasons, I totally agree with you. My legs are cramping because it feels like I have run 26 miles, and I really need to get to the restroom. I know this is an online virtual meeting, and this is probably going to be all over Instagram and Twitter later, but it is the truth. I'm not going to run away. I'll meet you all outside, and I'll ask my colleague Nick Banatwala to close the meeting. I thank all of you for attending it and look forward to shaking hands with you outside the door. Your turn, Nick.
Well, thanks very much indeed, Werner. In terms of concluding remarks, I'm going to use this opportunity just to say thank you to a number of people. I'm not going to try and sum up the very rich discussion that we've had here. So first of all, thank you to all the partners that have spoken today, especially to our host, the government of Philippines, for all the support that they are providing in the NCD space. I recognize that those speaking today represent a much wider group of colleagues that we work with. I'd like to thank those that contribute to the financing and resourcing of the work of the task force, including the Gulf Health Council, the government of Italy, the EU through the UHC partnership, the WHO Foundation, Novo Nordisk, Africa CDC. I'd also like to thank those that are financing and championing the work of the Health4Life Fund, many of which you've heard from today. Very exciting to hear from the Lilly Foundation. Thank you so much, in UNICEF USA. Also to the government of the Philippines, Kenya, Scottish government, Mauritius, and Uruguay. Thank you all very much. Thank you to the many governments that we have worked with over the last year. I'd like to extend and acknowledge the civil society partners that we work with. It was great to have Mike from Ravendi with us today, but also the NCD Alliance and United for Global Mental Health for their work on the steering committee of the Health4Life Fund, as well as the G7 and G20 Health and Development Partnership. Thank you to all of you that are contributing to the evaluation of the task force that Alexei mentioned. Please watch this space as this independent joint evaluation's conclusions are developed and are made aware. And finally, as the Secretariat would like to thank all of the 46 members of the task force that contribute to moving this work forward, especially those leading on different work streams. And I'm thinking here of UNDP, UNICEF, and WHO on Health4Life Fund, ITU and WHO for the work in the digital space, the Convention Secretariat in the area of tobacco, WHO and UNDP when it comes to leading the work on alcohol, OHCHR for the exciting work in human rights, UN Habitat in the urban health space, UNAIDS, UNFPA, and WHO for supporting global cervical cancer work through the Joint Action Group, and UN Nutrition. These are just some of them. Finally, a very big thank you to all ECOSOC member states for steering our work through the resolutions and supporting all all of our activities. And finally, a big thank you to my colleagues in WHO in New York, to Werner and Eva, who provide so much support for our regular meetings and making sure that we engage effectively at the New York level. Thank you very much indeed.